All right. We are at the 1 o'clock mark. Thank you everybody for joining us today. My name is Ariel Biggs and I am the programming chair for the Georgia chapter of HFMA. We are so grateful that you guys have decided to join us and really excited to have PwC presenting for us today. Just a quick few housekeeping reminders. We have our silent auction right now. We really would love to encourage everybody to stop by and crowd compass and check out the items. Also today, for those of you who need CPE or ANA credits, we're going to be utilizing the chat box to track how we are going to be able to determine who's still here so that we can give you your CPE and ANA credits. What you will need to do in the chat box to begin with is to type your first name, last name, and the word CPE into the chat box. And then I will be launching throughout the presentation 4 times. I'll be asking for you guys to say, I'm still here, and you'll answer with your first name, last name. So if you see in the chat box, are you still here? Then you would put your first name and last name. So that's really what we're going to need from that point of view from you all. And if there are questions about CPE, you can definitely reach out to us afterwards. We'll make sure that you get your credits and that everybody gets squared away. And so that's really all the housekeeping that we have for right now. And I would like to turn this over to Matthew Simpson and the PwC team now. So here you go, Matt.
Thank you, Ariel. I really appreciate it. Yeah, to the earlier point, we're happy to be here today. We're really excited to kind of talk to you about government relief funds and implications and opportunities for healthcare providers. So to start, we're just going to go into some quick introductions. With us here today, we have Phil Coos, a partner in the Philadelphia practice, a government contracts expert who has provided advice to commercial companies, nonprofit organizations, and educational institutions across the board related to many aspects of government contract pricing. We also have Courtney Shull from the Atlanta office, who is also a partner in PwC's healthcare practice with over 20 years of experience leading engagements for health systems, large multi-hospital systems, and physician groups. Additionally, we have Sarah Van Fossen, who is a senior manager and digital accelerator in PwC's advisory practice out of Philadelphia. And she has assisted clients with varying forensic accounting and government contracting issues. And then we also have myself, Matthew Simpson, a senior associate in PwC's forensics practice based in Philadelphia today. Again, we are really happy to be here, happy to answer any of your questions as you go along. We're going to be managing or monitoring the chat function or in Q&A function. And to the extent that you have a question as we go along, feel free to post it in there and we'll try and respond in real time rather than wait till the end, just so we can make sure we're actively responding to your inquiries. Again, if there's any areas where you'd like to dive deeper into a particular funding opportunity or a compliance related concern, just feel free to ask and we'd be happy to do so. So to start, I'm going to pass it over to Courtney, who's going to give a bit of a background on overall the agenda and what are the key government relief opportunities that have been received to date.
Awesome. Thanks, Matt, and appreciate this time with the group today. As Matt previously mentioned, so our agenda this afternoon, we really want to start by providing an overview of some of the sources of government relief that have been provided throughout the various pieces of legislation that have been passed to date. Unfortunately, we don't have that crystal ball of what's going to happen over the next few days or few months, but we're closely monitoring that. Today, we'll specifically hone in on those funding opportunities that are available to healthcare providers and healthcare entities with a particular focus on Medicare Accelerated and Advanced Payment Program, the HHS Provider Relief Fund, and then FEMA Category B measures. After sort of walking through those programs, we will then discuss, some of the challenges and implications that must be considered in accepting funding under the various programs. And then what recipients, such as, those of you on the phone should expect in terms of government oversight and monitoring. There's been a lot of, updates and around the oversight and monitoring component, over the last 2 to 3 weeks. Also, our team, is really leveraging our past experience and some of our, projections of what this may look like moving forward, and even some of our experiences, since February or March as we delved into this. So, while in many ways there's been sort of this unprecedented, government relief effort, I think, their expectations and requirements, under the government programs that will likely, be consistent with those requirements that we've experienced in, past emergency or disaster relief efforts. So, 55 minutes here, and we'll try and, get through this, this afternoon, but please, feel free to pop questions in the chat box. And then between sections, we'll have sort of a quick question for you to answer for CPE. And so we'll take a pause in between sections. So I think Matt, advance the slides. I want to give a quick overview sort of to start of the major COVID-19 implications, really legislation that have been passed to date, right? Through the Preparedness and Response Supplemental Appropriations Act, the CARES Act, the Payment Protection Program, and Healthcare Enhancement Act, the federal government has really infused substantial amount of dollars into the nation's economy, as we all know. The funding has included, industry-specific appropriations, funding allocations for small businesses through the Paycheck Protection Program, as well also expanded unemployment benefits, as well as direct payments to individuals. In terms of applicable to sort of the healthcare provider or healthcare entities, the funding's really been sort of in several different sort of pieces, right? There's been $175 billion under HHS through Provider Relief Fund. There's been another $200 million associated with the FCC telehealth grants. 20% increase in sort of Medicare COVID-19 payments. And then there's been, a ton, actually billions of dollars to really promote COVID testing, right? And now some of the clinical trials and things that are going on. Additionally, through the CARES Act and the Stafford Act, as a number of you I know on this call are familiar with, just due to some of your FEMA claims that you've been through, the federal government has appropriated about $45 billion to FEMA as a part of the Category B emergency disaster response. Despite some of these efforts to date, I think a number of CFOs that we've talked to with clients, believe that the economic response to the, pandemic has been improving, right? Is it sufficient at this point? Likely not. There's, I think parts of several markets across the country that would say, additional economic stimulus is necessary. And in fact, one of the things that we did is PwC launched a survey, right, where we interviewed finance leaders. And about 96% of those respondents, I think it was like 275 finance leaders, 96 of those respondents indicated that the U.S. economy needs additional fiscal relief to recover from the pandemic. And so, obviously, what's transpired last night and over the last few days, we'll see what happens on the Hill, and we'll see, what happens between, now and the end of the year, but likely the first of the year when this, comes back on the slate. Next, I want to cover sort of, really quickly around sort of the government relief fundings and programs available. And so when you think about, Matt, can you still hear me? It's showing my internet is going out. Am I still okay?
Yeah, I can hear you okay.
Okay, perfect.
Yeah.
Sorry about that.
You're good.
When you think about the programs available to healthcare providers, right, there's been this extreme focus really around the accelerated and advanced payment programs with, out of the gate, a lot of healthcare organizations were able to easily and quickly access, those dollars and felt that the program was pretty, easy to go through. And then you have sort of the Public Health and Social Services Relief Fund, which is really driven mostly by the Department of Health, and is allocated, 175 billion really related to expenses and lost revenues attributed to COVID. And then as it relates to the telehealth program, some organizations have been able to, ascertain some of these funds as it relates to telehealth initiatives that they set up as it relates to COVID. This was extremely impacted by a number of organizations, especially who, lost a ton of, volume as it relates to the ambulatory. And so tried to really leverage this telehealth program. While a number of organizations have been working on this for years, I think it was an opportunity to really double down quickly and accelerate, telehealth in some regard. And so there's been some funding that's been available from that angle. And then we've worked closely with our tax team to really look at opportunities around tax relief. And so there have been certain tax, implications here, or I would say, policies that have been instituted, and we've helped organizations think through what those tax strategies are, result in, help for bottom line perspective. Lastly, for this section, I think it's, what can you do with the money once you get it? I'm sure, a number of you, a number of institutions across the country have actually just paid their monies, back. Some of those being, some large for-profit entities. But, there are various forms of relief that come with sort of their own stipulations around the funds. And I think there definitely has been a lot of angst over, many months, to understand what those guidelines and regulations are, to ensure that, there's no hiccups in the future, as it relates to potentially having to cut a check back to the federal government, or making sure that there's, non-compliance with the receipt and actually tracking of those funds. So I think sort of the biggest areas that we've identified as potential uses of telehealth, some of the large, academic medical centers and some health entities who have a research function. Research has been, on the radar to help really cover the cost of some of the development of those vaccines as well as treatments. I think everyone's list has included PPE and supplies. I think coming out the gate, everyone was really tracking, hey, how are we going to get masks? How are we going to get COVID units, set up to make sure that they have the right supplies to be able to operate. And so that's been sort of a big use of funds. And then there've been several health entities that have, set up their own, COVID units or facilities. I know several of you on this call, as well as other clients we serve across the country, have dedicated floors or have actually turned some of their, call it non-core, assets into, a COVID facility, and there have been, dollars associated with that. And the biggest one has been around lost revenue, right? Which I think continues to be, a question, of concern, especially as it comes to reporting. What can you actually, use to cover lost revenue? Some organizations, depending upon, their fiscal year end, whether you had a, June 30 or you have a 12/31, you're having all these conversations really around how to track and
I think Courtney went out. I don't know for anyone else, Phil, for you as well, but I think to Courtney's point, there's just a lot of areas where individuals or the providers are going to have to track kind of what the expenses and lost revenue has been used for, because to his earlier point, while this is unprecedented, it won't necessarily be viewed that way in a year or two when there are audits related to the expenditures. So just making sure that things are tracked appropriately and making sure they're substantiated appropriately will be a key focus. Now that we're done this section, we wanted to just take a moment to go through our first Q&A question. And the first question that you should see on your screen is what type of relief was made available to healthcare providers as part of the coronavirus legislation. And I'll give you a few seconds to go through this. All right. Give you about 10 more seconds and then we'll move on to our next section. All right. So the answer to this question is all of the above. The government has basically made a variety of funding opportunities and incentives available to providers as part of the government relief. They have made loans in the form of CMS advanced and accelerated payments. They've made grants available under the Provider Relief Fund and through FEMA, and they've given a variety of tax incentives. With that being said, we're going to jump now to the first government relief opportunity where we want to talk in a bit of further detail. So we provided insights into the full opportunities and universe of what is available to healthcare providers. And the first one we want to dive a bit deeper into is related to the Centers for Medicare and Medicaid Services Advanced Payment Program. So as you may know, on March 28th, 2020, CMS expanded the existing accelerated and advanced Medicaid program to a broader group of Part A and Part B providers and suppliers. And this was intended to provide necessary funds when there was a disruption in submission and processing of claims. But CMS has the ability to offer these payments when there is a national emergency. So as a result of the passage of the CARES Act, they amended the existing accelerated payment program to provide additional benefits and flexibilities, including extended repayment timeframes for providers, among other benefits. So basically, the eligibility criteria for the CMS advanced payment program is outlined on the slide, but to apply, physicians are required to have billed Medicare for claims within 180 days of receiving the payment, or prior to the date request. They will have been required not to have been in bankruptcy, not be under active medical review of program integrity, and not have any outstanding delinquent Medicare overpayments. So ultimately, this program was suspended on April 26, 2020, after $100 billion was paid to healthcare providers across the country. And this was suspended in response and after the Provider Relief Fund was established that appropriated $175 billion for providers. And we'll talk about the Provider Relief Fund in greater detail shortly. Now, in the last 2 months, there have been changes to the CMS Advanced Payment Program. On October 1st, 2020, President Trump signed the Continuing Appropriations Act, which amended the repayment terms for all providers who had received an accelerated payment during the public health emergency. Now, providers may repay their advance payment at any time, and if the amount is repaid in full, these repayment terms will no longer apply, but we wanted to provide those just because they will apply to many providers out there. The continuing resolution will update the repayment terms so that repayment will not begin until 1 year from the starting point of the accelerated payment. After that, the updated terms allow for 29 months to fully repay the loan. And the cadence is that Medicare payments will be made on a 25% will be paid for the 11 months subsequent to the payment. After the 11 months are over, Medicare payments owed to providers and suppliers will be recouped at a rate of 50% for 6 months. And then after that additional 6 months, a letter will be sent for the remaining balance. So there is a that recoups certain amounts depending on the time frame you are separated from your initial payment. The continuing resolution also reduced the interest rate on the loans from 10.25 to 4%. So these were various updates that were made over the last 2 months. And another FAQ we wanted to point out, HHS has come out and said that provider relief fund distributions cannot be used to repay the amounts under the advanced payment program. There was some confusion in this area, and they've come out and clarified. Overall, in terms of benefits of this program, the program provided much needed liquidity initially in the April timeframe, and provided some flexibility for providers. And it also is trying to provide some ease in terms of how these payments are recouped, where they will just be offset against Medicare payments. So again, we just wanted to do a quick deep dive into the CMS area and the changes that have kind of taken place over the last 2 months with this reduction in interest and with this payment term expansion. With that being said, we're going to get to our second question, which is focused on the interest rate charged on the Medicare advance payments. So what is the interest rate charge on the Medicare advance payment program payments as of October 1st, 2020, after the update?
While you guys are answering that, I know a question came in about how much of all of this will have to be paid back, which we can talk about a little bit. It's a good question. I think, as Courtney had indicated, some people are already giving it back, but versus paying it back. I don't know, Phil, if you have any thoughts on kind of the payback.
Yeah, I mean, is how much will have to be given back? I don't know if we can answer that, right? Ultimately it's sort of at each entity's circumstances as to what type of losses, lost revenue they may have had, and we've got to look at that right from calendar year 19 to calendar year 20. And I know certain entities have started to see an improvement, and we have some of our clients that are saying, I'm actually going to be in a better place. So I'm not going to have lost revenue that I can actually most likely pursue, just based on having changes in the way I was reimbursed and such. The other piece is obviously expenses. And so it's, do I have eligible and allowable expenses? That's sort of a TBD because HHS continues to issue new guidance. It's conflicting and different guidance. I mean, when we look at the reporting, it talks about you can include your mortgage or rent or include insurance. And then we get to some of the facts. It talks about, well, only include incremental cost. And so I think, where that all kind of comes down to at the end of the day is going to dictate some of that as well. I think the intent is not to have a lot of money come back, right? The government wanted to put the money out there specifically to keep people employed, and it also, more importantly, for the healthcare system, to keep it where it was, right? They didn't want retrenchment. They didn't want, places not offering services and people not being able to get them. But I think a lot of it's going to come down to, I think the HHS has got to clarify the October 28th facts, because they're conflicting in what they say, and they're conflict not only within themselves but within the reporting guidance. But we do expect there'll be some funds that will go back, but it's going to be sort of specific to each entity. And as you guys said, some have just given it back because there's been either some bad branding issues associated with it, based on sort of how watchdog groups have looked at it, as well as we had one client, right, who finally said, I just can't, basically I can't take this anymore. These facts keep coming out, they keep changing, and I just don't have time to deal with this. I think we'll see those funds go back. Now, what do they do with those funds? We don't know. Are they going to extend out those funds to others? Maybe. We don't know that either.
Yeah, I think, Phil, the other thing too, that we've all talked about, right? We've had some clients that, have documented and said, hey, we've used what we can use up until this point, right? But now we're really solid and we're back on our feet. We're seeing, our volumes come back and things are actually moving at a faster pace than we expected. The question now becomes, are we going to see additional outbreaks as it gets towards the holiday, season and other things of that sort? So I would just caution, organizations before you think about, just ultimately paying that back, right away. Think about those sources and uses, and also think about, the potential next waves that could be coming.
Yeah, and I would say on that, right, you technically don't have to give anything back until sort of after the 30th on the provider relief fund, June 30th, once you kind of settled where you are and everything. So, hanging on to those funds to exactly address what Courtney's talking about, I think is something that, that can be done as administratively how they're thinking about this.
So in terms of the polling question, we had provided previously, the answer to the interest rate charge is 4%, is the update on October 1st. That had been shifted down from 10.25% to the 4% number. To Phil's earlier point, he was talking about the Provider Relief Fund. We're now going to dive deep into what the Provider Relief Fund program looks like, eligibility requirements, what entities are eligible for the Provider Relief Fund, what reporting and compliance looks like, and just general considerations about how funds are being distributed and what funding is available. So to provide some background, the Provider Relief Fund was established by the CARES Act and has been appropriated $175 billion to aid hospitals and providers on the front lines of the coronavirus response. Ultimately, these funds have been distributed to eligible applicants to reimburse for the increased healthcare expenses and lost revenues attributable to the coronavirus. There's also an additional pool of money that has been explicitly allocated to reimburse providers for treating uninsured COVID-19 patients as well. Now, in order to accept money under the program, recipients must agree to certain terms and conditions, which have compliance and reporting stipulations that will be required of the recipient. And if a provider complies with these terms and conditions, the amount and complies with the reporting requirements, the amounts received under the Provider Relief Fund program will not have to be returned. That's as the FAQ states. So since the creation of this program, HHS has continued to expand the eligibility rules for providers. Again, additional entities are now available. They have continued to add additional applicants and change the eligibility rules and expanded the eligibility rules. A full list of what constitutes an eligible provider can be obtained on their website. But generally, you must have billed Medicare fee-for-service for over the last, in 2019 or the first quarter of 2020, you must have filed a tax return if you are required to during 2017, 2018, or 2019. And then there are various other entities that are eligible, such as behavioral health providers, dental providers, things like that. So as the program has expanded, they've also expanded what providers are eligible under the program. Now, as I stated previously, the Provider Relief Fund was appropriated $175 billion under the government relief legislation. And to date, the program has dispersed $88 billion under, or been allocated $88 billion under what they're calling the general allocation, and an additional $55.9 billion under what they're calling targeted allocations. Overall, the payments under the general allocation are intended to compensate eligible providers with 2% of their net patient service revenue, while targeted allocations are focused on distributions to eligible providers across a variety of areas, such as rural providers, safety net hospitals, children's hospitals, and hospitals in high impact areas. So as you'll notice, approximately $144 billion has been allocated of the 175, meaning that about $30 billion is still available that may be distributed to providers in the future. The details as to what or which allocation will receive this remaining funding has not been provided to date. In terms of compliance elements under the program, HHS has specified that the Provider Relief Fund payments will be subject to the single audit in accordance with Subpart F of 45 CFR. We have a section that'll specifically focus on the compliance implications of this, so we'll dive into that a little bit later in the presentation. The terms and conditions of the Provider Relief Fund also require that recipients fulfill reporting requirements. And as you can see, they initially released guidance on September 19th, then they amended it on October 22nd, and they amended it again on November 2nd. So these updates are happening in real time. And the reporting requirements get at how the provider substantiates how they use the funds. Ultimately, providers will have to first report their healthcare related expenses attributable to coronavirus that has not been reimbursed by another source. And then any amount not reimbursed and not covered by this increased expenses will then be applied to lost revenues, which is represented as a negative change in year-over-year actual revenue from patient care related sources. So while there are different tranches and while there are different distributions underneath the Provider Relief Fund, they generally follow the following 6 steps related to the timeline. Providers must first determine eligibility under the funding tranche. This could differ, but that's the first step, is determine if you're eligible or meet the eligibility criteria of the allocation. Subsequently, providers must validate their TIN. just to avoid a duplication of payments. After validating the TIN, providers must then apply for funding. Now, the details as to what information is required is dependent on the funding tranche, but normally this requires financial or non-financial metrics and is meant to capture kind of the impact of the pandemic on the provider. Subsequent to the application, providers then receive the payment. And this is based on a methodology that is specific to the funding tranche. Certain targeted allocations have a methodology that is based on specifics that have been decided by HHS, whereas the general allocation is now communicating that you should have received 2% of that net patient service revenue. That's that key number that they're getting at in the general allocation. After receiving the payment, providers then have 90 days to attest to the terms and conditions or reject and return the funds. If the funds are not returned within the 90 days, then it is presumed that the provider has accepted the terms and conditions for the provider relief fund. And finally, the sixth step here is providers will be expected to report, and this is something we've talked about previously, that in 2021, providers will have to report on how they use the funds that were either expended in 2020 or have carried over into 2021. Obviously, many of these steps are kind of predicated on what funding tranche is being considered, but this is generally the process underneath the provider relief fund. Given kind of the timing of our presentation, we thought it would make sense to do a deep dive into the most recent general distribution, the phase 3 general distribution. Now, this phase 3 general distribution deadline is actually this Friday, November 6th, 2020. And it is meant to compensate all providers for 2%, or all eligible providers for 2% of their net patient service revenue, plus a potential equitable add-on payment. That is a terminology that HHS is using. And basically, they have given $20 billion in this bucket, and they are going to allocate 2% to every eligible provider, and any amount left over will then be paid out as an equitable add-on based on a calculation or methodology that is determined by HHS. And in order to calculate this equitable add-on payment, HHS is requesting that providers submit, or requiring that providers submit operating revenue and expense details for Q1 and Q2 of 2019 and 2020. So it appears as though HHS will make an assessment as to how the pandemic has impacted providers based on this information, and then make an equitable add-on payment to those applicants that they deem to be in greatest need. So basically, the phase 3 application is requiring that applicants provide supporting documentation, including tax forms and financial statements, to support this revenue and expense information. And while the timing of these payments is unknown at this time, HHS has said that the 2% payment will be
Is Matt frozen? Sarah, can you hear him?
Yeah, I think it's Matt, although the presentation now is also frozen. Oh,
Yeah, it looks like they're having some issues with Zoom overall. Looks like they can see us.
Yeah, I think there was a, it sounds like right there, lost all sound.
Okay, hey guys, this is Georgia, HFMA. We are going to pause the recording for just a second to make sure that we have enough time to look at this and determine what's going on. There are some Zoom technical issues. So hold on one second, we'll just see what we can do.